Now, the least favorite part of that first unit. We're going to talk about how you can determine the concentration of hormones in a clinical sample. I hate this part because I have to talk about radioimmunoassay, and despite the fact that this assay got, the person who developed this assay got Nobel Prize, explaining it is not a favorite part of the gig. So what I'm trying to say, it's kind of, tedious for you, not so much for me. So if you don't follow me, let me know right away. I don't want anyone to be lost. Deal? Like seriously, now don't tell me during the exam, oh, I don't know what radioimmunoassay is. So basically the goal of any assay for hormones is to determine how much hormone you have in the clinical sample, right? So how does radioimmunoassay work? You have a hormone, a sample of hormone with a known concentration where hormone molecule is radioactive. That makes sense? So I'm going to draw them. Okay, we're good? It's radioactive. And what's important, that is really important to understand. You know how much you have. So you know you have, 5 micrograms per milliliter or something like that. Is that clear? Not only this, in that sample of radioactive hormone, you also have antibodies, hence immunoassay, and these antibodies are bound to these radioactive hormones. Okay, you with me here? So this is not your clinical sample. This is your, say, control. Okay, this is your tool. Now, what happens next? You take blood from patient, okay? And you collect plasma or serum, whatever sample is. So far, so good? Now let me ask you a very, very simple question. In a patient, hormones in patient's serum it's a simple question. Are they radioactive? Like if you take my blood, is it radioactive? No, it's not. So that's important. Here, you have patient sample. Now, just FYI, rule of thumb, all the questions that I ask are usually really dumb. If I ask you anything above 0 on 0 to 10 scale, I'm going to tell you how hard the question is, okay? So, 0 out of 10. When you have a patient sample, before you do the assay, do you know how much hormone you have in a patient sample? You don't. That's the whole fucking deal, right? So you don't. All right. So what do you do next? You take patient sample and you take your control sample and you mix them. Does that make sense? We're good? You mix them. And here's what happens. Now, I'm going to use very, very unscientific language, but I think it's going to help to explain what's going on here. So, the patient's non-radioactive hormones will kick out radioactive hormones of the antibodies. See, I see the expression on the faces. What is it talking about? So I'm going to draw. Okay, so now you have, check this out, antibodies, right? Have antibodies that instead of binding radioactive hormones, bound patient's hormones. It's the law of mass action. Do you want to delve into chemistry, especially physical chemistry? Do you? I don't think you do. So, now look at this. These are brown fans. These are Steelers fans. So Browns fans kick out Steelers fans from their seats. Okay? Where do Steelers fans go? They go free. Okay? That makes sense? We good? What happens next? You can separate this from this. You can separate the antibody fraction from supernatant fraction. Right? You can separate these fractions. Now, let me ask you. Now it's kind of 1-2 out of 10. And basically the goal of the question is to see if you followed me through before. So, kind of going back, do we know the amount of radioactive hormone that we're using? Yes, we do. Yes, we do. We know how much hormone are bound to antibodies. Does that make sense? Can we measure the radioactivity? Why not? If we know the radioactivity that we had bound to antibodies in the beginning, so if we know how many Steelers fans were sitting in the first place, and we can measure how many of them got kicked out, the number of radioactive hormones that got kicked out is the same as the number of patients' hormones that kicked them out. Does that make sense? So you're indirectly measuring the amount of the blue dots by measuring the amount of red dots that they displaced. Am I clear? Okay? And yeah, you can build like a calibration curve, all that kind of stuff, blah, blah, blah. Sure, yeah. To make it simpler, to make it faster, to work with multiple samples, all that. So far, does that make sense, what we just discussed? So you see, without drawing, it's almost impossible to explain, and I don't really like to explain this particular method, although it's great. Any questions on this one? So the only other method that you have to know is what's called ELISA. Compared to this, it's a delight to talk about. Now, ELISA is not it is a female name, but it's called ELISA not because of females. It's an acronym. So basically, this is how it works. You have a plate, plastic plate, with multiple wells on that plate. So what we're looking at here are 3 wells. Okay? The bottom of each well, you have an antibody. Okay? Does that make sense? So these antibodies are unique in terms of the fact that they can recognize your hormone of choice, whatever it is. I don't know, growth hormone, okay? So you add patient sample, which contains a lot of hormones. You add patient sample, which contains just one hormone. and you add patient sample that has nothing. You with me? So what happens next? These hormones, they will bind to antibodies, right? Are you following me so far? And next, you add, you add what's called a secondary antibody that will slap like this, okay? And without going into too much technical details, you see this purple and the violet antibodies here? They'll generate some kind of a signal. Now look at this. This is so elegant. Check this out. The more hormone you have bound in the first place, the more secondary antibodies will be bound in the second place, okay? The more secondary antibodies you have, the more signal you have. Can you see that? Does that make sense, what I just said? So basically it means the more hormone you have, the better signal you produce. This is a very easily quantifiable method. And it's important, it's very easy to automate. So you can basically do it in the machine. Okay? Good? Questions about ELISA? Now, kind of an upside, I can tell you there's not going to be many questions on the methods. And I am not going to dive into a lot of technicalities. Okay? As long as you have a general understanding what's going on in each case, radioactivity is involved, no radioactivity is involved, you're fine. Okay? Yes?
What is the goal of ELISA?
Oh, to determine how much hormone you have in the sample, that's all.
Oh.
Because the more hormone, the stronger the signal. Okay? That's it. Like, this is one of the, endocrine is one of the most, I would say, quantitative specialties in medicine.